Okay, I'm going to call the meeting to order. Roll call first. Susan Bartley. Present. Charles Cavell. Here. LaRon Coleman. Colleen Crossy. Benjamin Greenwald. Sarah May.
Here.
Tanisha Moore. Michael Spitz.
Present.
Shelley Taub.
Here.
Pamela Turan. Dennis Yeager.
Here.
All right. Could I get a motion to approve the agenda from last meeting?
So moved.
Oh, I mean the agenda for this meeting. Sorry. I was ready for the minutes.
So moved.
Thank you. Can I get a second?
Second.
All those in favor? Is there any comments from the public? All right, let's move to updates from Committee of the Whole. Sarah.
Oh, no. I had to pull it up. So a big part of our meeting that we had on, hold on, sorry about this. I don't have it up. It was, oh, for goodness sake. Okay, here we go. A big part of it was going over our audit, which we passed. There were no issues found with it. That was really most of it. Eddie Brown with BDO went over the audit, and we passed it with flying colors. There were no issues.
Thank you, Sarah. Oh, and I forgot to say at the beginning, I added times to give us a general guide to how we should be progressing with the meeting. I've had to take a lot of stuff off the agenda, and we're rushing at the end, so hopefully this will keep us on track, and if I need to table items till the next meeting, I will do that. All right, quarterly financial update. Patrick and Nian.
Good afternoon. Okay. We're going to begin with our quarterly update. I'm going to turn it over to Niaz, and she's going to walk you through each slide this time. At this time, I'm going to turn it over to Niaz Bland, and she's going to walk you through the slides at this time.
Thank you. Hello, Nian Bland, the Manager of Financial Planning and Analytics. Just coming back into the room. Thank you. Is that better? Yeah. I'm so soft-spoken. Okay, let's do this again. Big girl voice. Nian Bland, I am the Manager of Financial Planning and Analytics. I am pulling my sheets up as we speak for a second just because this is a little far for me to see, and even though I have on glasses, I still need some assistance. So. Please bear with me. And I just won't connect. Okay, so here I go. Let's see. We're going to start off with the Is this my first slide? It was the first slide that came out. All right, so I will start here with our projected budget, the revenue section of this. And I'm going to point out a few things to everybody. One, this is the annualized budget revenue projections, and they are calendarized across our actuals that we are using for this presentation. There are some of these numbers that actually are based on actuals that we do have from MDHHS, and so those have been substituted here for what our projected numbers that go along with our BA1, that would be our budget amendment number 1. So outside of those specifics, which I will point out, we balance to that BA1 projection presented to the board as a whole. Excuse me. One of those would be our block grant. And that block grant number is what has been allocated to Region 8, that would be OCHN, for this FY24 year. And so that is that $3 million there. As we come down, of course, the women's services go along with that. Our Medicaid and our Healthy Michigan plan. Now, when you're looking at these numbers, I do want everyone to understand that these are projections based off of a percentage that was consistent with our projection and budgeting of the budget amendment and our reflection there. So when you look at these numbers that may seem low, or they may seem slightly off, or they may skew what would be our projections for our surplus or deficit, I want you to know that there is a BA2 in the works, which will have figures and numbers which better present our position for where we find ourselves ending at the end of the year. Okay? So as we move along, I just wanted to bring a couple of those points to you. We're good. We're going to keep going down to our expenses. Okay, so we'll do the summary here. That's the next slide deck there. So this is our revenue again in our column to the far left. Those are the points that we just went over. Our expenditures are based off of our actuals from October through May, and then annualized to represent where we see ourselves falling based on our activity today. Today would be May. And these are our numbers here that we end up with for our expenditures. And I think it has us at a 28 million? I hope that everyone else can see that too. Bottom line, for our expenditures for FY24 at the end, based off of those calculations and the logic, okay? So if we move to the far right column, we're looking at our surplus and deficit. What I'd like to point out to everyone is, number one, our PA2 funds. Now, there are direct expenses that are allocated to that funding source. And Megan, if you jump in, would that be like the MAT? What specific programs will come under that?
The Sober Support Unit, that is a monthly invoice and expense that is always coming in. Our third-party insurance, if we are assisting using PA2 as well, those are line items that are coming in every single month.
So when we talk about our PA2 direct, these are the types of activities that we're speaking of. Outside of that, our PA2s, our funds would be utilized to supplement and offset where we have shortfalls under our other activities and our funding sources, okay? Block grant is one of those, and that is on trend and what has happened year over year, okay? We also have prevention. So prevention usually falls about $1 million under budget, okay, every year. And so, excuse me, PA2 funds are used to supplement that as well. Then we'll have our overs and unders from our other sources of funding. You'll see Medicaid in there. You may see Healthy Michigan. This year you see it, with this presentation you see it here. And again, let's remember we'll be doing a budget amendment number 2, which should actually bring that closer to where we see ourselves really falling and not so dependent on projections and estimations. And those are the biggest funding gaps that PA2 cover, okay? So then we do have some flexibility between Medicaid and Healthy Michigan, where they offset each other, okay? Those funds can be reallocated between to cover overs and unders. So where we find ourselves, I'll pull up the 2 points here. Our estimations align with normal funding activity and exceptions to returns, expectations to refund a portion of the approved BA2 funding to reserves. At this time, we really can't say what that will and won't be, where we will land, but it is our estimation that funds will actually go back into the reserves, okay? And that was from the 4.3 that was approved for this FY24 year, okay? Sure.
I didn't mean to interrupt the chairperson. Okay, sorry. So I have a question about that then. Can you say that again, where the 4.3 came from, and then where we can see it distributed in the budget?
Okay, so I don't think I got that deep into where it came from. So the PA2 funds, and please, Patrick, keep me on course, and Megan, feel free to jump in, but our publish our allotment every year, okay? And from that, it goes directly into the reserves. What then happens is we do some number crunching and some estimations, and we come before the board and we ask for approval to use a certain amount in that FY year, okay? Anything that we do above that, we will have to approach the board again for approval, and Megan, I believe, makes some different announcements of what those funds would be going to, okay? Then when we have not spent the entire amount that was approved to use, we then return those to reserves.
Understood. But you were saying you think there will be a surplus out of the 4.3. I know we had talked about this in the last meeting. Can you remind us what that amount will look like? And where in this budget for 24 we'd be able to go, oh, this is, $1 million is filling the Healthy Michigan $1 million gap. I think you were kind of saying that.
Okay, so I did not get into numbers specifically, and again, I apologize for my lack of having everything in front of me, but I did not state an exact number. If you do the math in the numbers presented, if you take the PA2 number, and I believe that is 3.27 million, and it's going to cover, again, based off of this projection and our logic for presenting it, it's going to cover what would be a deficit in our prevention number. If you look at that line item, I believe that's a 1 million number. It will cover, as stated here in our presentation again, it's going to cover what's presented as a shortfall for the Healthy Michigan, okay? And then it's going to cover a shortfall that's reflected in the general fund right now.
Who's general fund?
The general block grant, the general fund block grant. So I should say block grant.
Okay.
Does that make sense?
Yeah.
Okay, everybody with me? Okay.
No.
Did I answer your question? Yes. That's my belly, thank you. If we can move to the next
Shelley?
slide. Go ahead.
Oh, Shelley had a question.
Yeah, how much of the PA2 funds are expected to be given to CMH, to the mental health portion of the organization?
So no funds will be given to the mental health portion of the organization.
We did that this year. Why is it going to be different next year?
Well, we don't enter into the year anticipating that, but we budgeted because we know that there were.
I'm sorry, can you speak a little louder?
We know there were some shortfalls in some of the line items in the overall budget, and we allow, this is not the final year end, and so a lot of times we true up at the end, and there's adjustments that need to be made, and we make sure that there's ample amount of funds to cover any anticipated or unexpected expenses.
So
shall
your
we?
fiscal year ends when? September 30th?
That's correct.
And is it the same for the other board?
That's correct.
Okay, so how much this year have we used from PA2 funds from for the mental health budget?
We've used zero, and there is no, I'm talking Shelley.
Okay, yeah.
So, when it comes to, the past use of PA2 funds, so OCHN as a whole, right, not just the SUD network, the mental health network, OCHN as a whole, we're underfunded by the state for all of our services. And so then what you're referencing is previously in the past, what has happened is to ensure that services have not been cut for any population, there have been times where finance, they have come and they have said, you know, in looking at truing up our books at the end of the year, we would like to be able to use PA2 funds to cover specifically the SUD services and then move that funding over to the mental health side. As of right now, as it stands, none of that has occurred for this year. That is not being asked for this year. The budget and the numbers that we're talking about now, the shortfalls, it's very specific all to SUD. And it's things that, especially for our block grant, we're always aware of walking into it. Our block grant, we know we're underfunded from the state every year. With Healthy Michigan, we're starting to see deficits come into play for a multitude of different reasons. Again, that underfunding, we're seeing large picture from the state, from all of OCHN, and then also just a change in calculation for how the budgets are being done on the back end to show better true numbers. Because numbers previously would project us to have like a $9 million surplus, which wasn't even close. We weren't even there. So finance has really done the work to say, let's really work with our accounting, our consulting firm. What is the better formula that we should utilize? So that's why there's kind of a little shift in numbers that you've seen maybe from the first quarter, but in terms of what funding, what PA2 funding is being used for any services besides SUD for this year, it is none. It is all SUD.
Okay. However, I do believe that some of this PA2 funding was given, we voted on something to mental health for the people who are duly diagnosed. Is that correct?
Yes, but not this fiscal year. It was for the last fiscal year.
Okay. So we didn't just vote on anything like that?
No, that was last summer in September when it was September when we presented the fiscal year's budget for this coming year as well as the past fiscal year and asked for the use of PA2 funds.
Do you anticipate that we will be asked once again for PA2 funds?
For this year, as an FY24 year, additional funding above the 4.3 that has been approved already, I don't foresee that.
The 4.3, though, was for last fiscal year or this fiscal year?
That's this fiscal year.
Okay. And you don't anticipate that any other funding will be needed? Okay.
No.
Thank you very much.
And we wouldn't be able to, move those funds without this board's prior approval.
Okay.
So you would know prior to that happening, if it were to ever happen. So.
Thank you. Next slide, please. Oh, yes, I'm sorry.
Charlie?
Thank you. You have on there county local match agreement in the revenue category, and then you show the expenditure actual, and then you show surplus deficit as county local match agreement. I'm just curious why you did that instead of putting the dollar amounts, because when I was prepping for this meeting, I did the math, and there's, the math is different because, revenue minus expenditures does not become equal.
Charlie, can you say it again? I'm sorry, you were
All right.
I didn't understand your initial.
Why did you use why'd you use words? This might just be a nerdy accounting question, but
Sure.
County local match agreement instead of saying 50,250 and 17,764, because.
I can change that format. I just didn't change it from previous
Okay.
time. It caught my attention as well.
Okay.
The local match does not come in and actually fund into the budget. It's a pass-through, if you will.
Sure.
Yeah.
Okay,
So
I
next
d-
time, you got it. So it'll
Okay.
balance,
sure, understood.
absolutely.
But it's not like some Gatsby thing or
Nah.
some sort of best, okay, cool, all right, thanks.
Okay. Next slide, slightly out of order. Okay. So this is very small, but I believe that it was in your board packages as well as we look at it on the deck. And what we wanted to do here, and I won't get into details of this, we'll be in a better position once some actuals come in and we can speak. I'm going to use the term intelligence on each of the differences and what the causes were. Of those are variations from year over year. This is the same format, same funding sources and line items. Our 2022, 2023, and our projected 2024 of where we see ourselves. This was added on the request of having a more robust opening up information and transparency to the board of our past and present financial positions and usage. Sure. Oh, I am on the 3-year budget comparison. Yeah, it's very small on there. I believe that there was a printout of it in a better readable format included in the board package that is available. But again, this is the, let's say, the beginning of newly presentation of information to the board as we move forward for you all to have the financial information to make those decisions on the PA2 usage and funds. Sure. I'm sorry.
My other question is that on the agenda, there are 2 places where we talk about this PA2. So are we talking about different fiscal years, or what are we, because I believe we vote at one point and then.
On the part of the agenda where it's listed as a second part, it's because that was old business. It was request that was made. And so we just have it on there for old business to wrap it up and be able to formally say in the meeting that we have covered it, and moving forward it will be able to continue to be covered. But it won't be a second vote at the second part of the agenda.
Yeah, it's just a update, a follow-up with information. Okay. Oh, Charlie?
Thank you, and I think as one of the people that asked for this, this is very helpful, thank you. I have 2 questions. First, I'm new to the board, so forgive me if this is common knowledge for everyone, but the Healthy Michigan plan went down from 23 to 24 by over $6 million, right? We see the drop of $10 million in the budget for revenue. So what that huge drop, what do we account for that, if there's time to talk about that? And then the second thing, as part 1, PA2 other, same sort of question. It's $600K drop from 23 to 24.
Okay, so I'll go backwards, if you will. The PA2 from last year to this year, if you recall, there was a request for a higher ask for usage of funds. So that was part of the decrease this year over last year, if you will.
I don't know what that means, I'm sorry. This is my second meeting, or third meeting, so I don't know what that means.
Charlie, are you referring to the revenue, the top part where it's the budgeted revenue that you're asking where the difference is, or expenditure?
Well, that's actually the funny thing, because that's my second question, because the expenditures didn't really change. But the revenue.
The revenue is different because the PA2 that we receive in every year from the county, it changes. So it's all based on the liquor tax and the convention tax that the county receives over the course of the entire year. And of course, that number can completely change. And then by law, they are required to allocate at least 40%, and it also has to be no less then I believe fiscal year 22 or 23's total number is what gets allocated over to us. So you're going to see that number over the years continue to fluctuate, probably anywhere between 4.8 to 5.1. That would be my guess of what we've seen over the last 2 to 3 years, but that's why it changes. And then
That's the PA2 other.
that, yes.
Okay.
And then, of course, the expenditures, they can change yearly, but we do a lot of times, we know what we're ending up budgeting for. You can see that our expenditures, they do stay the same a lot. It's typically a lot of the same things that we are always using it for. We have our funding, the block grant funding that comes from MDHHS. It has been static, and we have been underfunded at about the same number for the past few years. So we're always able to account for that.
Right, and so then why did the Healthy Michigan plan go down in revenues by over $6 million in the course of 1 year?
So with Healthy Michigan, there has been a decrease in the revenue across the board. Healthy Michigan, there's been a decrease in the revenue across the board, Medicaid and Healthy Michigan. And I did not get into details. Eddie's not here to go into the breadth of those details, but there was a projection percentage decrease in our projection. So 24 is a projection, okay? And so with that decrease, it funneled over to our SUD allocated projected revenue as well. And that's why you'll see that large decrease. And again, this is in the spirit of budgeting closer to where we will find ourselves and factoring those considerations in our estimations as opposed to doing maybe a blanket actuals annualized and looking at things like that, or annual calendarized, going the reverse way.
So part of it is when I had just referenced that they recalculated, they redid the formula because it was giving such a high projected number that was grossly not accurate. So that's partly why you see the decrease from the previous fiscal year, because we started using a new way of projecting the number that they vetted through forgive me, I don't finance, it's Richard, that's all I know is it's Richard.
Our consultant.
Yes, the financial consultant vetted it and said, yep, this is what a better formula to use for actuals. And then, of course, just with redetermination, we've seen it go down a bit. And then with the lack of increased funding that we're seeing from the state as well, everything's remaining static right now with the state and has been. We have not been receiving increases, and it's not specific to SUD, it's across the entire system. For all of OCHN, we are not seeing increases in our Medicaid or HMP.
Okay. And then my last question about this budget was, and thank you for that description, Megan. So there's a $10 million surplus in 22, and then a $13 million surplus in 23. And looking at the budget, if I'm reading it right, what happened to the, like that should be a $23 million surplus, right? Because at the end of 2022, there was $10 million extra, and at the end of 2023, there was $13 million extra. You put those two together because looking at this math, 33 into 19 is 13. So why is it not 23? What happened to the first 10, if you will, or, because I know we did we gave some of our SUD's money to OCHN to fill one of their budget gaps last year.
Our SUD's money always stays with us, but then that Medicaid money or Healthy Michigan money can be moved over to the mental health.
Okay.
Yep.
So we gave our Medicaid money to OCHN full board.
I wouldn't necessarily say we gave our Medicaid money over to mental health. I would not say that because there is one pot, if you will. I'm going to mention this again, and I am still researching, so bear with me, and this can be something that we follow up on in our next meeting. From what I understand, at the federal level, there is an appropriation. However, at the state level, there is not. We receive Medicaid funds and we receive Medicare, Healthy Michigan funds, okay? Now, based off of percentages and different calculations, we allocated for presentation to do a line, line over line. So we're looking at revenue over expenses and where we will fall. What we don't use is not necessarily just SUD and only SUD, and SUD gets to hang on to that year over year. That's not how the year over year flow, and that's not how those revenues are managed and maintained. So it is that where the activity or services come in for claims and are requested, those are the actual line items, those services and networks that receive those fundings. So if I can just kind of paraphrase, the allocation of revenue for services, SUD versus behavioral health, are actually geared and driven by the services provided. So the payments come out of the pot, and that's the way the revenue is distributed. I hope that makes sense or helps you.
Yeah, so if
Okay.
I hear you right, that's why then there's this huge drop-off, is because it was a more, I guess, realistic actuarial accounting of what the services actually provided by the SUDS team are versus OCHN as a whole, because Healthy Michigan Medicaid comes to OCHN, is distributed based on like resource allocation.
One purse, right?
So you kind of readjusted what the actual versus the intended is, which is why it looks like $6 million budget cut or giving away to the whatever. It was all in the OCHN bank account in the first place. It's just the resource distribution is now more trued up.
Accurate recap.
Okay, got it. Thank you. Thank you. Okay.
Shelley, did you have a question?
Yes, the state budget, hasn't that already been passed? So shouldn't you know what the revenue's going to be?
I'm going to say we have not received that information as published to us, but then I will defer to Patrick. There was just conversation about that.
FY25?
I'm sorry, say what?
FY25 or 24?
Whatever you're going into now would be FY 24, 25.
25.
25, okay.
We have received preliminary rates, yeah, but it's not the, so.
Pardon me?
We have received preliminary rates, but they're not final, but we do have something to base our projection and our budgeting on based on the preliminary rates that we have been provided.
Well, I don't get that, because once they're in the budget, they're in the budget. Either it's $10 or it's $2 or it's $1,000, but I don't understand what preliminary means. I guess I don't understand that part.
We're provided a rate, and then it's finalized sometime this month, and in August it will be finalized, the amount and the proportions, but we haven't gotten that final rate from the state. So
I'd like to just add a little bit to that. So what passed was the state budget. What did not pass that we have not received yet is the MDHHH budget. So our behavioral health budget has not been sent to us, and our rates have not been sent to us. So we're in the process of formulating a budget just off preliminary rates, but we're in the process of that. And then we'll adjust it once we receive final rates.
Okay, thank you very much.
Yep.
All right, let's move on to, are we done with that and then moving on to the PA2 activity?
Yeah, I think this is for the next slide. I think we're done with that. Yeah. And this was also requested. So this is going to serve two purposes. This goes to a old business from last meeting.
Can we wait until old business to do it?
Absolutely.
Okay, let's keep going with the agenda, please. Charlie, do you have a quick question?
Yeah, I thought, did I miss us going through the FY25?
It's up. It was up.
We should be on 6B, so we haven't gotten to 6C yet.
Did we already do this slide though? FY25?
No, it was just presented right before you. I didn't speak to it yet.
Okay. Can we speak to that? Because I have one question on it.
Well, have you spoken to it yet? I thought she hasn't spoken to it yet.
Rick? I thought you wanted to move on to the next agenda item.
That's 6C.
Is that the next agenda item? I'm sorry, I just want to hear about this slide. If that's what you're saying?
Yes, that's what I said.
Appreciate you, my bad.
Okay. So FY '25 projected budget, there's a few things that I do want to point out here. One, we are slightly moving out of order here. We are looking for the PA2 approval so that we can have a solid number to move into our full budget process as well, okay? And so we are using projections. Again, we don't have actuals or finalized numbers from the state, and so we're moving based off of what we anticipate, okay, knowing that we will more than likely do an adjustment here, okay? All the numbers that you are looking at here as in revenue and our expenses are general numbers for you to consider when we ask for our PA2 approval rate to use into our FY '25. Let's keep that as an understanding. And what we will find here when we look over to our far right column is the line items that we anticipate having shortfalls, deficits, that we anticipate PA2 funds supplementing, okay? And so that would be SOAR. SOAR is new in a sense, if we're looking at thinking on year over year, because our SOAR funding was decreased, okay? So the plan is to continue our SOAR programming, but we will supplement the funding of those programs from PA2. Another one is our prevention line, which mentioned before, follows our trend, about $1 million each year. If you see that number there too, it's about $1.2 million. And then as we go up, we will see the block grant. Again, that's our normal trend. And we look to supplement that funding and the needs of it under our PA2. You'll see a $20,000 projected loss between Medicaid and Healthy Michigan. And as mentioned before, I just want to say it again, Healthy Michigan and Medicaid can actually be reallocated within each other. So I did not bring that up as part of a supplemental use for PA2 in this projection. If you do the quick math on all those numbers, that usage would bring us somewhere near that 4,000 asks that we're presenting to the budget today, to the board today for our PA2 usage or funding for FY '25.
So in terms of the $4 million for PA2, to kind of go off a little bit more of what Nian has been speaking about for the budget, one of the items she talked about was the state opioid response grant. That's a grant that we have had for quite some time with MDHHS. We received our allocation from the state about a month or so ago, and they significantly cut our funding for that by almost $800,000. The reason for the cut, and we weren't the only PIHP to receive the cut, almost every other PIHP received about the same amount of cut on up to about $1 million+. And the reason for the cut is because the overdose rates and deaths for the state of Michigan have decreased. So it shows that the work we do is working. However, because the work we do is working, they've decreased the funding for that. For us personally, and our belief and our philosophy here at OCHN, the projects we have been doing under SOAR, it's imperative that we continue them to keep decreasing the overdose rates. So projects that we will move over to PA2 that were covered under SOAR are our jail medication-assisted treatment program. The reason we are moving that program over is because there's a large administrative tasks that were required under the SOAR funding, so it is helping to alleviate that work for our provider who's doing that work. Our other large item expense, which is our OEND, our overdose education and naloxone distribution, our Save a Life boxes, we will be keeping that underneath our SOAR funding. Also, we have our housing assistance program that we are able to offer housing funds, startup costs for people to get their own place to live. We will move that under PA2. Other items that we fund under PA2 with this $4 million is the sober support unit individuals with third-party insurance issues. Typically, if someone is underinsured, we're able to use block grant first, but there are times with the payer orders we cannot use block grant, and we're the safety net for the county, so we will step in and assist individuals. The one example I always give, I can have someone who has a private insurance, Blue Cross, HAP, medication-assisted treatment is fully covered, and we have had this come through Access. Their insurance has said, you have to go to a clinic in Ohio every day to dose. Well, that's not feasible. They live in Michigan. So that's a time where we step in, and I can't use block grant as a fraudulent funding source because they are fully covered, but what the insurance is asking isn't feasible. So PA2 is less restrictive in terms of our funding, and I'm able to step in and cover the person's funding for services in our network. Other items that we fund are prevention and treatment services for the block grant underfunding that we receive. We have advertising and marketing materials that we put on there that aren't fully covered under our block grant. We have the My Strength program, which is our online emotional wellness tool. And then we have other miscellaneous items that can come up throughout the fiscal year. One of the things that we always plan for, we have coming up our state recovery celebration, as well as our own OCHN recovery celebration. So we reimburse our provider network the cost to bus the individuals served who are receiving services to each of these celebrations. We want to make sure that people in our network, they can enjoy these activities, they can be a part of a sober network. So we will reimburse our providers for the cost for busing. So that is the large majority of what the PA2 funds are used for each year. Yes, Shelley.
Okay, I am looking at the 4,000 number. I think you've lowballed it, really, quite frankly. We've had several big events. Pardon? 4 million or 4,000? 4 million. Did I say 4,000? I meant 4 million. I think you've lowballed it because we've had several massive events in the city of Detroit, all of which bring in tons of alcohol.
Mm-hmm.
Okay, we had the Final Four, we had the draft, and we had people drinking, partying for days on end. So are you going to let us know what your final numbers are when you get them? Because I think we're going to get more money than that.
But does that money go into PA2 when it's served alcohol? Or is it just purchased at store alcohol?
It's the tax for alcohol, it's convention taxes, so any of the convention centers in Oakland County that are putting on events. But the dollar, did we already get the set dollar amount from the county we have coming in for fiscal year 25, or is that a projection?
We don't know.
We don't know with certainty yet. So that
Right.
number could change from what we get for the county because we're still waiting for it. Our budgeted dollar amount of what we believe we will spend for fiscal year 25 out of PA2 is $4 million.
Okay, so if we have any extra, we will be told. Maybe we can do something terrific for people instead of having to give it to other organizations?
Yep. What will happen is it goes into our reserves, and so then it's there for us to use and look at what other programs are there. I know that there's programs on my radar. There are things on my radar I want to look at doing. A couple things we have to get through right now is finishing the fiscal year 25 budget. We do have a couple things that could come up and change it. So we're kind of waiting for 10-1 to come to really settle down, really see some true numbers. And until we get that, I don't want to start saying, hey, I have a $500,000 project I want to look at. I want to let the money settle and see where we sit.
It should be online shortly, though.
Okay.
You should be able to access all of the budgets in Lansing online. Thank you.
What? Michael?
Thank you. Just a point of clarification, for me anyway. The $4 million that we're being asked to vote on today is a budgeted amount that we're going to look to spend, right? The revenue is going to be, we expect it to be higher than that,
Correct.
if I understand correctly.
You're correct.
All
Correct.
right.
We expect the revenue 4.8, 5.1, somewhere in there.
So, and if I go back in past years, we've never, in most years it's been below 4 million, way below 4 million. But I think it gets to Shelley's point, we need to be spending more of this PA2 money on SUDs than we have, and that's where you come up with your ideas potentially to spend to get us to that 4 million. Is that correct?
We expect most likely for this year that $4 million, I think we are going to spend the majority of it on the actual budget that's presented. We will then have about 1 million that goes into reserves, plus we then have the reserves, and from there we're able to look at, like for example, there's a project that I know would cost us $500,000 a year to support fully by PA2. So we have to, that would be something we have to keep in mind and budget in. And so, but I want to wait for 10-1 to come, because one of the things that we're looking at first, we're standardizing rates for a few of our codes right now. That could affect PA2 dollars and what our overall dollar amount looks like that we're using, right? So it's like I want to get through our budget standardization, our few codes that we have left, before I come around to the board and say, hey, I've got this for $500,000 that it would cost us each year. And so I'm kind of waiting for that to settle down before I start saying, because we're very conscious about planning for long term. It seems like it's very far off, but PA2 2039 is essentially the sunset of it. And with the way we're funded from the state, we found out about a month and a half ago that they were cutting our state opioid response funding. So we weren't given a lot of time before the start of the fiscal year. Many other PIHPs are cutting their services then. So like right now we have things, and I'm mindful of when we do anything, whether it's under our COVID block grant, whether it's under the ARPA funds, what's the long-term funding? Jail mat, even when Christina was here, she said from day one that SOAR funding ever gets cut, it's PA2. So it's keeping in mind all these projects we have under grants. I have to also keep in mind if our funding gets cut from the state, we talked about that hitting PA2, plus other projects, plus PA2 eventually going away, plus keeping a reserve. You're welcome.
All right, is there any other discussion? Charlie.
Thank you. So 2 questions real quick, and to piggyback what Shelley was saying, just a compliment. I appreciate you, as I think what Shelley was saying, lowballing the budget, like the estimations that, we save more and then are able to, have more instead of overestimating. So thank you for doing that with the 4 million for PA2 guesstimates. I appreciate that. So my first question is, so since this is a projection and you were explaining this with the Healthy Michigan Plan, it's fair to assume, just looking at this budget, not the specific numbers, but the value projected in it, like the goals of it, that we don't want to use PA2 to cover any Healthy Michigan Plan services, because we're going to true up that accounting and be able to use just direct reimbursement from the state. Is that right? Except for the $20K difference.
So our hopes would be that when that Medicaid and Healthy Michigan Plans funding would be able to cover those eligible services under the way that the projection is stated and the logic and methodology behind it, it does not fall in here for this projection.
It's
Our
always
overall goal, go ahead.
It's always the hope,
right?
That we wouldn't have to use funding for that. But we are not going to know, and what we are going to see, especially with the projected numbers for fiscal year 25, really working on a lot closer to actuals, we're going to see a budget where those Medicaid and HMP numbers, they shift month to month based on eligibles, based on who's been redetermined, because we get paid for those number of eligibles every month, and so that number goes down, our revenue goes down, right? So that is partly what we will see. Am I saying that right, Ian? Okay, I was going to say, I think I am. So I think next fiscal year, we're going to start to see a little bit of a roller coaster. Also, I think at the higher level with executive leadership, I know that they are working very diligently to try to discuss with MDHHS the fact of the PIHPs, the system, we are underfunded, and we are not able to we're being challenged every year to provide services and meet the needs of the people, and the needs are growing, but the money being allotted by the state is not, and it is staying static. And that is kind of the projection coming high level from the state over this coming fiscal year, and I think the next one as well. Bed Bodkin, who is our lobbyist in Lansing, what he is hearing for fiscal year 25 and fiscal year 26, everything's static, nothing's moving, all the money's staying the same right now in terms of what's getting pushed down to us as the PIHPs in our network. Only increases in funding that are being seen are with CCBHCs right now.
So then, but back to the question, the Healthy Michigan, you're not going to try and take PA2 money to then fill any gaps based on what this budget?
The hope would be to not. And that's where it comes.
I reserve a comment to say yes or no at this time.
Yeah.
Because it's
the hope would be to
foreseeable.
not, and that's not what the intent is. And if we start to see that as we start to move through next fiscal year, if that would change, one, the dollar amount of what we projected for PA2, or two, if we are seeing that we are going to need to do that, that would be a discussion with the board, so that way the board can fully understand, hey, this is why, this is what is happening, these are the dollar amounts coming from the state as to why. But no, it's not the intent. Is it possible? Yes. But I agree with Nia, and it's hard for us to give a hard yes or no, because we're going to get 3 months into next year, and we're going to see it look one way, and 2 months later, I think we could see it look a whole nother way.
Understood. Okay, thank you. My second question was, with the SOAR program, 2025, and I know these are round numbers, but 2025 is estimated cost, or revenue would be $850, which is a huge decrease. The expense is expected to be $1.6 million. But if you look at the last 3-year projections, or the last 3 years, it was $590K spent in 2024, $667K spent in 2024, and 765K spent in 2022. So why have a $1.6 million budget if the last year you spent $590K? What's the $1 million extra dollars for that also we're now not getting because the revenue is going to be $850?
Couple different reasons, and with this past fiscal year especially, we will have, for some of what we projected to spend for some of the SOAR programs, we've actually had to move money around in our line items to cover, because we're going to go over budget in some of our line items, not within all of SOAR, but within our line items. One of the reasons our jail mat program, at the start of this fiscal year, we had it capped. We only allowed 24 individuals in the program. We were also not offering sublocade. So since the start of the fiscal year, we no longer have a cap, so any Oakland County person can receive it. So that really changed a budget in previous fiscal years of about $220 for the entire fiscal year. Now our cost is probably going to be around, with the addition of sublocade as a medication, we're looking at probably about $550,000. So we've seen that cost go up by about $300,000 as well.
But that doesn't account for why the total cost was $590.
For SOAR, yes, that's just one project of SOAR. So
but
same
the entire
for
SOAR budget was $590.
No, our entire SOAR budget. Which slide are you looking at?
So if you look at surplus and deficit on SUD 3-year budget comparison. So teach me where I'm getting this wrong, please. But the SOAR line was right there. So the surplus, not surplus deficit, sorry, OCHN FY24 SUD Q3 expenditures. If you're looking, I don't know, it doesn't have a page number. Is that 14? Oh, 14, yeah, thank you. Yeah, 14, so help me understand. So we had, all right, the FY24 SUD full year projection for this year, $872K. Minus, budgeted, okay. we have 872K surplus. 1.4 million expenditure. Oh, I see it. I saw expenditure as revenue.
Okay.
Different. So then that's what you're saying is the increase, the like jail mat, and that being not just jail, that's what that huge increase was from 667 to 1.4.
Yes, and then
Got it.
also the OEND,
Okay.
the overdose education and
Cool.
naloxone distribution.
Understood.
We upped the efforts for the Save a Life boxes, which that's increased cost
Okay.
as well.
Well, so then I guess flipping the question. Oh, no. Okay, that's great. That sucks that they're cutting the budget.
I know.
Understood.
I know.
Okay, got
I
it.
agree.
Now I get it. That's terrible.
Okay, yeah, did you have something to say?
Yeah, I just want to be a little bit transparent on the PA2 question with Mr. Cabell. So the question was, are we going to use it for Healthy Michigan, correct? So the $4 million ask out of PA2 is to help allocate all the correct fund sources so they can be balanced out in the budget. So if there's any shortfall, that $4 million will go towards that. So there's no request for additional than $4 million, but any leftover would offset SUD Medicaid or SUD Healthy Michigan. So the request will be for the full $4 million, to be transparent.
That's coming up on the agenda.
Yes.
Okay. So all right,
Yes,
I'll get to
that's
that
on
then.
the agenda today.
Then I have a lot more questions, but I'll say that.
Colleen?
I just want to say thank you to Shelley for championing this, bringing our attention more to the, I remember one time you said that if we continue to, like if we don't use it, we lose it when it comes to them cutting budgets and stuff like that. You're well aware of that. So when we get our budgets cut, I wonder if we have someone who could say, okay, well, where does this go then? If it's not us, then who? A better reason than oh, because you succeeded, we're taking away your money. Why? So that we fail? I mean, because we succeeded because we have the money, because we made this a priority. So what's the big idea, taking away our budget? That's the level of assertiveness, slightly aggressive, that I would like to see.
I think you're volunteering to advocate for us.
Yeah.
Shelley?
Well, there's an association that represents this organization here. It's a state association, and they have to advocate for budget needs. And if the state government, the governor and the legislature say, we're cutting the budget for substance use is going to be cut by $10 million, and I'm just giving you an example, then everybody gets cut, period. That's the end of the story. There is no, and the budget's been passed, and hopefully our advocates in Lansing have followed, been able to get some increase in whatever, but once it's done, it's done. Doesn't matter how good a cause it is. It depends on what the state's priorities are. And to me, in my personal opinion, it's roads, because I can't go from here to there anywhere. So, and it certainly isn't some of the stuff we do here, sadly.
All that's funded by taxes, by the way, just as we all get our tax bills for our houses and stuff. So Shelley's advocating for higher taxes, I think. So I appreciate that, Shelley.
No.
Keep that up, I'm with you.
Not on your life. I'm just advocating.
Where are we going to find all this money for SOAR then? I'm so confused.
I'm going to send my bill to Charlie.
All right, let's stick to the matter at hand, please.
Speaking about advocates, though, I do know that our CEO, Dana, has been meeting with legislators constantly the entire time that they were putting the budget together for months. She has been meeting with legislators. So has the lobbyist and CHS M-A-M. I always try to spell it ham. But, I mean, I went to the conference in Traverse City. There was constant talk of pushing for different items in the budget and raising the budget and fighting against different cuts that they were trying to make. And there were wins. It's just difficult to see it when everything is remaining static, because there were wins in the form of stopping certain cuts and certain regulations from taking place. But Dana and the OCHN team have been meeting with legislators constantly for months, so there has been advocacy.
And then also the SUD directors for all the PIHPs. We meet once a month, and we meet with Alan Bolter from the Community Mental Health Association. He joins our meetings. He talks to us about all things going on in Lansing and the funding. He talks to us about the bills that are coming down the line. He's asking for what we agree with, what we don't agree with, and then our funding concerns that he takes back to CHAM as well to help advocate for.
Michael. I move to approve $4 million to be included in the 2025 SUD projected budget.
Second.
Maybe I'll take a roll call vote for this, since there's been so much discussion. Let me find my roll call. Susan Bartley?
Wait,
Okay, more discussion?
yeah, because we just saw presentations about the projected budget, so the 4 million is what you're estimating from the PA2 to be incorporated into the projected budget.
C.
Okay. All right.
All right, is there any more discussion before I take a vote?
One last thing then, so it's based on this slide that we're looking at, that's what we're saying, that's what we want the budget to look like at the end.
We're only voting on the $4 million.
Yeah, I know.
For PA2, not the budget itself.
But that's not like receipt of the $4 million to then
No,
further.
it's just to include $4 million into the overall budget for 2025
Yep,
of the PA2 monies we're expecting to get.
yep. And we still don't know if we want to then,
And
because
then-
of the way money works
Right.
with the Medicaid reimbursement, put that $4 million towards Healthy Michigan or Megan's cool 500K plan she's got for something or anything else. We don't know that yet.
For the most part, the numbers that you see up there, the block grant dollars, the SOAR amount, those dollars that we use the great deal of money of PA2 to cover, that's what it's going to be going towards. Nia and I don't have it in front of me, her and I sat down and literally figured out what we projected, what-ish and exact, and we're looking at 3.56, I think it was, when we looked at what's our shortfall every place, and I think we didn't even factor in the $20,000 that's showing for, I think, Healthy Michigan, because we have an overage of Medicaid that we can move to cover it. So as it stands right now, that's not, like I said before, not the intent, could be. But the $4 million, that's our, we go a little high, we say, okay, we're looking at, if it's 3.56, we think for things that come up, for example, this past fiscal year, the OPV study, the money's already budgeted for, it's just coming to the board and saying, hey, can we do this project that's already been budgeted for? So having that little cushion in there.
Okay, and so then, I do have one last question then. So, since we are using this projection then as like informing our decisions, we will end 24 with a $2.3 million surplus. And then we're projecting to have a $1.15 million surplus in addition, so that means we should have roughly 3.5 million surplus.
There's more
All
than that.
speaking in estimates.
There's another 10 million in reserve.
So to clarify, in PA2, it's like 10 to 12 million in reserves.
Okay,
So, and that would be offsetting whatever we end up. There should be a surplus this year.
okay.
So that will be added to that, and then there should be a surplus with this projected budget to be added to probably another 1.1 million, something like that.
So
So-
that $10 million doesn't mean that 4 million comes out of the 10
Sure.
million, that's,
Yeah, it's
yep.
4, I get it.
Correct.
So then there should be 10 from previous years.
I think it's
2
12, but yeah.
Okay, so 12 from previous years, 2.29 from this year.
No.
Well,
So-
what did we just read when we looked at 24 projections?
Okay, so I think that slide needs to be adjusted a little bit, because under the revenue side, it lists the 4 million, when it's actually or 4.8.
Sure,
The expenses side only shows 1-point-something million out of PA2.
sure,
That's where the 4 million should be,
sure,
and it should be the net surplus of the 1 point whatever.
sure. But FY '24
Yes.
should have 2.294 million extra
Projection.
to '24. So the previous slide with the 3-year thing, it has
We should have used the 4.3.
2.294
That's 4 point.
surplus.
So the ask for '24 was to utilize 4.3 million.
I know.
Okay.
I'm just trying to make sure I know how much we'll expect to have in reserves so that we can all think as a group how to spend all that money to help our people.
Okay, so the
I'm
expected
trying to
at
figure
the
out
end
the
of
total.
'24
Yep.
should be right around 12 to 13 million.
Okay. And that includes what we're projecting as surplus for this fiscal year,
So
That doesn't include fiscal year '25.
'24, because
Right.
we're, right.
Yeah.
So-
And the 2.2 at the bottom of the projection for FY '24, those aren't PA2 dollars.
Correct.
Okay,
That's just where we find ourselves in the projection for net
Okay.
over under.
okay,
So that 2.2 does not go into
PA2.
our reserves for PA2.
Understood.
Okay.
Do we get to keep those extras, that 2.2 extra, or that goes back upstairs to OCHN? Total.
So there are some funds that revenue expenses and where it shows a surplus, we don't hold on to those funds. Those would be things like ARPA funds,
Mhm.
those don't carry forward. So not all funding line items, the difference or available funding, carry forward to the next year.
That's what I was looking for. Okay.
Okay.
But this 1.1 will,
Correct. For
and so it'll
PA2.
be 13 or 14 at the end of '25. 12 or
Projected, yes.
13 at the end of this year.
Correct.
Cool, thank you.
All right, are we ready to vote on the motion?
I think that this was what Commissioner, what is your last name? Cavell was talking about, the format of this, it didn't like add up. I don't know, whether he was talking about it or not. Yeah, thank you. Yeah, I took a look at it and it was a little quirky to me too, because, it really didn't add up. But I wonder if, but I do like the timeline. I do like F18, F19, FY19, FY20.
Did you have a question?
My request, I'm going to vote yes, but my request is to get it in a format so that people like me can understand it a little better. I just don't understand it.
And you're speaking to
Because
the
I-
5 years, right? You're speaking to the PA2 5 years.
No, it's just that the numbers don't seem to add up to me.
Can you turn your page around so I can just see what
Oh,
you're
up.
referencing?
Yes.
Okay.
Yeah, so that's doable?
Yes.
Thank you so much.
All right, are we ready now for a vote on the motion? All right, Susan Bartley,
Motion to approve.
Charles Cavell,
Yes.
Colleen Crossy.
Yes.
Benjamin Greenwald. Sarah May,
Yes.
Michael Spitz,
Yes.
Shelley Taub,
Yes.
Dennis Yeager.
Yes.
Okay, wonderful. I thought there was going to be some no votes on that. All right. Let's see, I even lost track of where we were. All right, legislative updates, Christine.
No, I'm good. I think it is the hot seat. So, just before I go into some of these slides, legislative update. Yes, the governor did sign the budget, as, Ms. May has shared. I think Dana met with 20-something legislators between January and June. We are very engaged with Community Mental Health Association. We also have our own legislative consultants. So most people were very surprised by the flat budget. There are a lot of anticipation and really some ideas. It is an election year, so that may have impacted it. There were some important projects. We did advocate for direct support professional increases. I learned about the SOAR just last week as well, so we'll look at that as other advocacy opportunities for us. I will say that the expectation is an election year. We will have a number of people campaigning through November. They'll probably come back for a few weeks. We will have new legislators that will have to be educated about the public mental health system. So between October and November, we'll start to develop those different advocacy materials, establish our priorities, and then start the process over again in January. So we have a list of bills that were presented to us that impact our organization. So our subject matter experts within OCHN are reviewing the information and then offering, is this something we want to support, remain neutral, or something that we want to oppose. I do believe that once the governor, once she signs, right, that's when the real work has to start. What's unique about our system, as you're talking, ebb and flow through the years. That's why our reserves are so important. We never know when a reduction is going to come in. And then, likewise, in May, we might get word of extra funding that's available that we're asked, can you spend this by August? So we have learned to pivot when needed and just keeping people at the forefront of all of our decisions. Any questions? Next slide. I'm sorry, what? They are? I thought we were moving them. Oh, I'm going and I'm coming back. Do you have any questions about anything? No? Okay.
All right, Suzanne, with community outreach updates.
Good afternoon. I will be brief. You can go ahead and go to the next slide. Just wanted to highlight, obviously, many of these events have already occurred because the month of July is ending after today. So just wanted you to be aware of some of the events that we have participated in or hosted over the past month. We usually provide this information to the other board as well, so we always want to make sure we provide this to you during the month of July. As you can see, I just want to highlight a couple of things, obviously supporting the Rochester Hills community and continue to do that to this day. We were just there today for their Wet and Wild event. Also hosted our Minority Mental Health Awareness Month event earlier this month. What a great success, great conversation. So I encourage you to join us for some of the events that we have coming up that I'm going to be talking about. Next slide, please. Just as I mentioned, some additional events that we are participating in or hosting for the month of July. As you can see, as I mentioned, the Rochester Hills, also supporting our local farmers markets and being present at those events as well, providing information on all sides of the organization. This is just an overview of some of the July and August events, some of our events that are coming up. We do have a big event that we host every year. It's our annual Your Voice, Your Value conference, and that is where we honor individuals for their achievements, and we have peers that we also honor. So our Peer and Achievement Awards are recognized at that event, and a lot of those individuals are on the substance use disorder side, so we would love for you to be able to join us for that event on the 15th of August. Just wanted to highlight some of the press releases that we have go out, and actually we've had more than just 3 this month. We also released the SINAR press release this month, which we had a 90% response rate for SINAR, and I think you're going to hear a little bit more about that later, but I just wanted to let you know that information has been put out into the community about that. In addition to our ongoing advertising with our SUD funds and SUD dollars that are on both radio, TV, billboard, bus ads, cable, also in the malls. Those are, if you're ever in Great Lakes Crossing or 12 Oaks Mall, hopefully you have seen our ads there. I know a few of us have seen them recently, so hopefully you can see that. Next slide, please. Just wanted you to be aware of some upcoming events that are pretty important, but all of our events are important, obviously, but these are some things that some are related to SUD. We have our community workshops that we host each month, and those are actually a virtual workshop that we host. There's one coming up in August, and that's on stigma and substance use disorders. So if you're interested in joining us, we can make sure you have the information in your packet. It might be nice for you to just join in, listen in on we have some great speakers, very good information. They offer CEUs as well. We also have our annual Walk a Mile in My Shoes rally. This is the 20th anniversary of Walk a Mile in My Shoes. We're going to be in Lansing on September the 12th, and we usually have a couple thousand individuals out there celebrating walking and behavioral health as well as developmental disabilities. Next slide. Our recovery celebration is coming up. We're really looking forward to that. It gets bigger and better every year. Lots of enthusiasm about that one. It definitely gets bigger and better every year. I'm excited to see the entertainer. I think everyone's pretty excited to see the entertainer that is going to be coming out as Kalichi is going to be, and he's a person in recovery as well as a hip hop artist that's going to be entertaining everyone, as well as many other activities that are going to be going on and celebrating Recovery Month. So we really hope that you can join us for that event. And then another exciting event we have coming up is a Connecting the Community. So it's a substance use and mental health resource and job expo. We are doing it in partnership with Oakland University. So another great opportunity to get out there, be connected with our community, and especially in that setting with our student population. So really looking forward to that event as well. Again, please feel free to come and stop by. I believe that might be the last slide for me.
Yep, that is.
All right.
Are there any questions? Colleen?
I'm just curious, do you happen to know for the Job Expo what kind of people would be signing up to look for people to look for jobs?
So we'll have a variety of different of our providers out there, as well as OCHN will be out there that will be recruiting with students. We're sending the information far and wide to let people know that that resource is available, and as well as information will be provided, as well as opportunity for jobs. And there will be some presentations to talk about the various information and various organizations. Some of the organizations will be presenting as well.
The reason I ask is because some of the jobs don't really provide their employees a living wage, and some of the jobs are dead-end jobs. So I was just wondering if...
Anna has been integral in planning this event, and she's got some additional details she would like to share.
That'd be great. Thanks.
So when it comes to this being the Job Expo portion of it, we are reaching out to the schools so that way they can learn about their internships. We're actually having HR for the providers who are signing up to have their on-site interviews. They're having HR beta, that way they can explain some of the student reimbursement rates that are out there right now to pay back for student loans and things of that nature, as there are many for social work and for education. We have right now School of Medicine, Nursing, Public Health, Criminal Justice, Political Science, I think education that are looking to partner and to have their students come, that way they can learn about the different programs, as well as legislation we're hoping to have there too, that way they can also see why we are encouraging and advocating for similar rates across the board, so we can see those pay increases, so they can see the need of the services. And also we know there's a huge job shortage. McBath himself actually gave us kudos for the fact that we are one of the few PIHPs reaching out to try to challenge some of the job shortages that we do see. We've had this announcement out for 2 weeks, and we already have half of our providers signed up with their HR committed to come.
Great, because I just wouldn't want to give certain employers a platform and they don't treat their employees in a way where they can have upward mobility.
Yeah, right now we're putting out to all of our community partners and providers, because those sometimes can change. I've seen growth over the last 15 years I've been in Oakland County. Some providers start great and then not, and then go back. Leadership changes. And sometimes it takes some new students or new employees to see the change, and we're hoping that helps change some of the workforce attitudes too.
Wonderful.
Thanks for saying that, like lifting that up.
All right, any other questions on community outreach? All right, let's
Thank you.
move. Oh, sorry. Thank you. All right, let's move to the director's report with Megan.
Yes, so I will be quick and give a quick high-level overview. I'm so sorry, Miss May, because you're going to hear this a second time, but I'll move through it quick, so don't worry. So what I wanted to share with everyone today is what we for SUD and some of our providers in our network, we will be a part of a recovery incentives pilot with MDHHS. So next slide, please. So in November of 2023, MDHHS announced this recovery incentives pilot. They requested an application from the PIHPs if they had interest in some of their provider network participating in this and to submit the applications by December of 2023. We received notification in April of 2024 that we had been selected, and we expect our first cohort to start October 1st of 2024. Next slide. And so what the recovery incentives pilot is, it is contingency management being implemented at an outpatient level. So essentially it's evidence-based treatment, and it's reinforcing individuals' positive behavior, things like abstinent engagement in treatment, having negative drug screens, and when somebody consistently is showing up to their therapeutic services or have those negative drug screens, then they're able to receive a reward or an incentive for doing that. So how the incentives will work, it is individuals are provided gift cards. The total amount a person can receive over the course of a year is $599, and that has to do with taxes, and anything above that requires a 1099, I believe. I'm like, which tax number is that? So yes, and part of what MDHHS has done is they have put out an RFP a while ago to have a vendor come on to be their incentive management platform. So it is a third party that is going to have an electronic platform, essentially probably an app that's built, and that is how all the incentives are going to be managed for individuals. The incentives will also be delivered through that management platform as well, because we know with contingency management, when the person does that desired behavior, they also need to receive that reward immediately for it to be most effective. So they will be able to input all the information, the providers, they can put out all the information real time. You know, people are showing up for their group therapy appointment, they can sit there with, the therapist can sit there with the device, enter in that people are showing up, and the person can receive their incentive immediately. So we put this out to our provider network. We asked which of our providers had interest. We had 4 of our providers that came back and said, we are very interested in being able to pilot this. Before we even had this come up with MDHHS, I knew before the November when they did a formal announcement. MDHHS had been talking to us behind the scenes, saying, hey, we're looking at doing this. What do you guys think, you know, your involvement would be, or your provider's involvement? 2, we also know for those who are receiving medication-assisted treatment, we know best practice is for the contingency management to be used. So with our COVID block grant dollars we received, we had provided contingency management training to our entire network. So in knowing that this would eventually come down the pike, we had already prepped our network and been able to pay for, under those COVID dollars, all the training that they would need to receive to be able to implement contingency management. Next slide, please. So the primary goals are to improve the health outcomes for beneficiaries, increase engagement, reduce the number of emergency department visits, and reduce adverse health outcomes. Next slide. And our responsibilities as the PIHP, we will have a person on our team here that is the lead, and they essentially will work with our providers. They work with MDHHS, and they'll make sure, and they'll report back, provide data, but they'll make sure that everything is rolling out and have that direct oversight over the provider network for this pilot. We will receive $15,000 in startup funds from MDHHS. The majority of that money we'll use to cover our staffing costs. We're not hiring, we're using existing staff, but that we will utilize those funds for partly staffing costs as well as then look at promotional materials to put out to the community as well to promote this. Our provider's responsibility is they will have 3 staff who are trained on this pilot. Some that are the direct line workers who are doing the day-to-day work, other individuals who need to be higher up to make policy changes at the organization. Providers are being given startup funds by MDHHS that range from $7,000 to $10,000. So the providers who are in the first cohort, and we do expect we will be in part of the cohort 1 that will start 10/1. Fingers crossed. I think that date could get pushed out a little bit because of contract negotiations MDHHS is having with the incentive management platform entity. But we will be a part of cohort 1 when it launches. That first provider will receive $10,000, and then the rest of the providers who are in the other cohorts will receive $7,000. And that's just because that first cohort to stand up, that's going to be the hardest. That's going to be where we have our ebbs and flows, and we kind of just figure things out at first. Next slide. So our current status, we'll launch in cohorts. We'll be in the first one. We had a readiness assessment that was sent out to our 4 providers to see who was in the best spot out of the 4 to be that provider that's chosen for the first cohort. And then how is MDHHS funding this? Part of it is using opioid settlement funds, and the other part is they are looking to put this under the 1115 waiver for this to be a Medicaid reimbursable service. So we are using Medicaid codes for some of the things that we're doing. Yes. Any questions?
Yes.
Yes.
Hi. So it's the first I'm hearing about this program. So is it costing us anything out of pocket?
No. No, nothing that would be in our line items or anything like that. The drug screens that are being done, that is being done via a billable code to Medicaid. The $599 incentive, those dollars, that's coming from MDHHS and opioid settlement funds. So that's not coming from our budget.
Got it. And this is only for Medicaid?
Yes, it's only for Medicaid individuals, which I pushed very hard against because that's just not how I operate, especially because they're using opioid settlement dollars, but I think partly because they're pushing for it to go under the 1115 waiver, and they are modeling it after California did this. They started this pilot, I think a little more than a year ago. That's why they're keeping it to only Medicaid. I mean, I'm still going to push behind the scenes because I believe in it being the same for everyone. So that was a very hard one for me to swallow and agree to doing this for only Medicaid. I tried to say, can't we use our PA2 to do it for our block grant individuals, but the issue we have is we don't hold the contract with that incentives management platform. So we run into a little bit of an issue, kind of, you know what I mean?
Yeah.
It's the state who holds that contract, so I can't just add that on. Yeah.
Do you have any information on what the individuals are doing to hit these benchmarks or whatever it is?
That is part of what we are waiting on right now. So part of what was developed by the incentive management platform, it literally outlines week 1, if they meet what the behavior is they're supposed to meet, they get this dollar amount for a reward. Week 2 is this. I think partly in what this is still in the planning session, what I believe is it's kind of got to be partly individualized, so it's not a blanket statement of every single person you have to have a clean drug screen. And part of the conversations we also have to have are, just because I have a clean drug screen, if my drug of choice is an opioid, but I'm still testing positive for marijuana, in my opinion, that's a good drug screen. Now, where does that stand, though, in the realm of how they look at this pilot? So those are discussions still being had, because in my opinion, from a harm reduction approach, opioids are what is going to kill you and you're going to overdose and die from. You're not going to really see that from marijuana. So if I have someone decreasing and not using opiates, but they're still using marijuana, That's the least of my concerns right now. If it's causing problems in your life clinically, I have a clinical background. Clinically, we'll talk about, is it causing problems? Do you have issues? But probably not like the problems that exist from using heroin or fentanyl.
Last question on this from me is, you said they're doing this in California. Is
Yes.
there any data coming out on that?
There is little to none, and because they are only newly into this. And so literally the only data points, and I just sent it because I presented this at the Committee of the Whole as well just a few weeks ago, and this exact question was asked. Brad, he reached out to MDHHS to say, we know you're basing this off of California. What data points can you give us? And they go, there's little to none. All they could send us was this little 6-slide presentation that an entity in California did that they were able to show just some preliminary numbers that they're seeing. So I can have Kara forward that to you guys as well to see some basic data points coming out of there.
Thank you.
Yes.
Any other discussion before we move on? Charlie?
Yeah, I just want to say, one, this sounds awesome. 2, do you know who the incentive manager platform is?
I do, and I just hope I can remember right now. Alterum? Yes, Alterum.
Okay. What is the size of the pilot we think we're going to get up to, each cohort or whatever?
Each cohort, I believe, is 24. Is it 24? It's 24 or 30 individuals. The cohort remains small. It's 30 individuals, but it's a provider's decision on they can keep it open and rolling. You know what I mean? So it's not like a closed group. It's not like everyone has to start at the same time. They can choose to keep it open and rolling, and people can move in and out of it.
Understood. Okay. And then to your question about this being just Medicaid and wanting to expand it to be more of a holistic approach, I would love to follow up offline with you and Tricia about how we might be able to work with the county to expand this to be a thing that could work. Because I think what's really cool about this, having talked with you about it or read about it, is this seems to be the start of an effort to, I guess a way to say it is, make people's jobs to be in recovery.
Mm-hmm.
You're rewarding them, incentivizing them, in a sense giving them gift cards or paying them to focus on their recovery, which eliminates 10,000 hurdles.
Mm-hmm.
If your focus and goal is to get into recovery and you're being compensated for that work, that's great. And that seems like a great culture shift, mindset shift. So I'd love to talk with y'all offline about how the county can support.
Thank you. All right, let's move to treatment updates with Bradley.
Okay, so we have some admissions data for our SUD treatment providers, all levels of care. This is just kind of going through each one. Start off with ambulatory withdrawal management, which is non-medically monitored 24-hour detox or withdrawal management service. The person gets medications to bring home with them to help them comfortably withdraw from whatever substances they were using. We have one provider that offers that service right now, Sacred Heart in Madison Heights. As you can see in Q3, there weren't any individuals enrolled in that service. For intensive outpatient, or what we call IOP, we had 57 individuals enrolled throughout our provider network that offers that level of care. For non-intensive or standard outpatient treatment service, so we have 134 people enrolled or admitted. For the 24-hour withdrawal management I was just talking about, That's 231 individuals. Next slide, please. Medication-assisted treatment. So this is outpatient treatment that involves certain medications like Suboxone or Methadone to help individuals maintain recovery. We had 163 enrolled or admitted. For long-term residential, over 30 days or 28 days, we had 50 individuals. We have Turning Point is our provider that offers, is the only provider that offers that service. For short-term residential treatment, we had 370 enrollments or admissions. Women's specialty services, PRISM, that type of thing, we had 26 individuals. Next slide, please. Our sober support unit, that's assists with immediate substance use needs of the community and enhances jail diversion efforts. This program operates 24 hours a day, 7 days a week, and assists in placing individuals into a higher level of care treatment within 24 hours. In quarter 3, we had a total of 375 people that went through the unit, person served. Of those people that were admitted on the unit, 353 ended up following through with treatment and going into some level of care of treatment, which is excellent. Next slide, please. Thank you. For our SUD Health Home update, for SUD Health Home admissions, we had in quarter 3 20 individuals. For the opioid health home admissions, we had 34. Next slide, please. Thank you. State opioid response grant, we just talked a lot about that today. The jail MAT program. In quarter 3, we had a total of 103 individuals served. In that program, we had, of those that were admitted, 0 were prescribed Vivitrol. That's kind of on trend from previous quarters. Suboxone, we saw 80 people prescribed Suboxone, and for Methadone, we had 22. Out of county MAT expansion, so out of Oakland County, we had 156 persons served, 0 again on Vivitrol, and 90 people were prescribed Suboxone, and 4 were prescribed Methadone. And lastly, for underinsured, what we call underinsured, just talking about that, OCHN routinely assists in covering the cost for services for those who are deemed underinsured, and without this financial assistance, individuals needing services would not have access to affordable care. So in quarter 3, we had a total of 120 individuals that were assisted with this cost of treatment. And that is, that was the last one.
And just to help clarify, when it comes to the numbers, those were our quarter 3 numbers, so not total number of individuals that are currently being served in the network. That's just for this quarter, how many people were being actively served, or opened, I should say, for that quarter.
All right, any questions? I think Shelley?
You have out-of-county residents, or non-residents of Oakland County, being served with our tax dollars?
Are you referring to jail mat?
Yeah.
No, it is not being served with, they are not being served with our dollars. We are administering the jail mat to every single person in the county jail, whether they're in county or out of county. Those who are in county are paid for by our dollars, and out of county is paid for by opioid settlement dollars that is coming from the county. So it's not opioid settlement dollars that OCHN's receiving. It is the county's opioid settlement dollars that they are receiving, and they approached us and said, we need to offer jail mat to all individuals. You're already doing this. You're the experts in the jail. Can you take your in-county jail mat program and completely make it the same for all the out-of-county individuals, and they pay us?
Okay, so
And our
Oakland
provider.
County then is paying for people who live in, as an example, Genesee or Wayne. I'm
Yes.
just making that up.
Yep.
Yeah, okay, thank you.
Yes.
Sarah?
With the Vivitrol, what's the reason for it not being prescribed? It's longer acting, right? Is it more
Right.
that it's the patient's decision?
It is their
Okay.
decision, yeah, and unfortunately, it's just one of those that doesn't tend to be as popular.
Okay. I mean, if it works for them, it works for them.
Yeah. And we usually see those same type of numbers at our community map providers. Really, Vivitrol, for people who are more of the novice or a newer opioid user, it might be a better fit, but for a lot of our opioid users who are long-term users, it's really what they need for that brain chemistry balance is the Suboxone or the methadone. Yeah.
Colleen?
Okay, I just wanted to say, I used to work at the Washtenaw County Jail, and people aren't always, where they live is, it varies. So if they're in Washtenaw County Jail, that tends to be, they could be homeless because of their substance use. So anyway, I wanted to know a couple of questions. MAT, what does that stand for?
Medication-assisted treatment.
Okay. And health home, is that like a group home or what?
Nope, and it always seems that way, and I yell from the sky every time I talk to MDHHS, please stop calling this a health home, because it is in no way, shape, or form any type of home. So it drives me nuts. But our SUD health home, our opioid health home that we have, it's a care coordination service. And so underneath the opioid health home, essentially we offer health home services through some of our providers. And it's work that they were already doing previously, just never being paid for. So that care coordination they're doing with someone's PCP, they're actually able to get paid for that as a care coordination benefit, whether the person has Medicaid or not. Because of the funding streams we're using underneath the opioid health home, it's funded by Medicaid. Under our SUD health home, we are funding it under ARPA, I believe. Not block grant, I'm pretty sure it's ARPA. Forgive me, we have a couple different funding. I'm pretty sure it's ARPA that we're funding it under.
Okay.
Yeah.
Thanks.
Yes.
All right, any other questions? All right. Let's move to prevention updates from Hillary.
All right, so I will keep this brief. So two parts of this. So the vaping initiatives, I know this was something that had got brought up just to kind of know what we're doing within the county. So a few of our providers, and I'm just going to give a brief overview because there's a lot of wonderful things we're doing, but just for sake of time. So there's some evidence-based practices that are happening within the school systems. Some of those programs are Catch My Breath, Botvin Life Skills, and also In-Depth is another program. And so these are different curriculums that are occurring within the school systems that are teaching tobacco, vaping education, both from a health, emotional, physical standpoint. So that's all encompassing. They're doing a lot of presentations within, for both the students but also the parents, so that the parents are educated as well. So there's a lot of that parent education going on out in the community as well. We have a lot of advertising going on with our prevention providers, between them putting out different things on social media, billboards, flyers, things of that nature. And also we have the advocacy. I know that's been a kind of a hot topic today, is what's going on, policy change. You know, how are we working with the schools to make sure that if an individual is caught smoking or with a vape or things they shouldn't have on them in the school system, how are we supporting them and it not being punitive, but how can we work to support them and really intervene where it's needed? So there's a lot of work going on as well there with a lot of our prevention providers. So that's just kind of a brief overview. Like I said, there's a lot within those school systems. They're definitely using their time wisely in terms of how they're really hitting the schools and addressing those needs. Another thing that Suzanne had talked about earlier with one of the bulletins that went out, or the press releases that went out, was in relation to SINAR. So really quick, just an overview. I know there's a lot of acronyms. So SINAR is legislation that came out in the 90s about not selling to underage individuals to any type of tobacco product. And so it is a requirement that we are educating the community. So part of our funding is that, and requirement under SINAR is that we have education that goes out to the distributors of tobacco products. So they actually go out to the retailers and have conversations and provide education, because not a lot of people still know that 21 is the age. A lot of people still think it's 18. So they have raised that federally in terms of being able to purchase tobacco. So they want to go out there so that we're not selling to underage individuals, and also just how to support. So that happens. One of the big things is, so we send out underage inspectors, and obviously that is done safely. That's done with staff. And the purpose of that is to go out and see if all of the education and support that we've been doing is making a difference. So they go out and they're undercover, if you will, and they try to make an attempt. Again, they're not purchasing anything, but they make an attempt to see if the retailers are actually not selling to underage individuals, checking IDs, things like that. And we passed with a 91%, which is fantastic, because you think about going out to all these retailers, it is big business and there's a lot of money in it. So it's really great to know that in Oakland County, 91% of all of the individuals and all the retailers that they reach out to did not serve to the individuals. So they had checked IDs and done all of the necessary protocols. So that's fantastic. That is a 21% increase over the last 2 years from the providers and the retailers in Oakland County. 6% we've seen just from last year alone. So all of the efforts that all of our providers on the prevention front are doing is making a difference. We're seeing that that really is helping on a large scale. So that's just kind of a little bit of an overview. And then something exciting looking forward into fiscal year 25 is underneath our block grant, there's a specific grant called the Tobacco 2 funding. It's a small grant of only $4,000, but the intent of that is specific initiatives to tobacco and the use of vapes and things like that. And so what we're going to be doing for fiscal year 25 is purchasing, they're called hidden in plain sight kits. So it's like a mock-up of a bedroom. And the intent is to show how vapes take on different shapes, sizes, and different things like that, how what might look like a water bottle might actually be drug paraphernalia, may also be a vape, and different things where people may hide things, and just kind of educating parents who might think that this is just a jacket, but who knows what's inside my pockets, who knows, and just kind of keeping people on the current edge of what's going on. So we're going to be purchasing 2 of those kits, and those are going to be made available to our prevention providers to incorporate into their parent education and their schools and just different things like that amongst the coalition. So we're really excited about that. That's something that's going to be coming next fiscal year, so more to come with that. So I know that was a lot, but any just kind of quick questions related to some of the wonderful things that our providers are doing currently?
Question? Not a question. I just want to say thank you very much. I didn't even know what SINAR was. I mean, it's been around since the 90s.
Yeah.
I didn't even know it was an acronym. Thank you. I appreciate that.
It's actually a last name. It's the legislative gentleman's last name, SINAR. That's where that came from. So it doesn't stand for anything. It's his last name.
Oh, okay.
And why it's important to know, and why we always talk about this, why we talk about SINAR, is because the efforts we do and the percentage, the compliance percentage that we receive in our county, it's directly tied to the block grant funding we receive. And so if we as a state receive less than 80% compliance, our block grant funding can be cut from the state. So it's always so important. We do our part as a county. We want to see as a county that all of our retailers, and for 800 retailers, do we have, what's 500? It's a huge list of retailers that we have in our county. And everything's picked at random, and the fact that we had a 91% compliance rate, I of course always want to see 100%, but I'm over the moon with that number. That really shows the great efforts that our provider, who's in charge of SINAR, and we work with them directly on it, they're doing a fantastic job.
Thank you. All right, so we have 12 minutes left. We do no longer have a quorum, and I do want to wait for the board term discussions, so until we have more people. So we'll wait. We can't approve the minutes, so we're going to wait on the new business. Now, the question for the board is, we'll stop maybe a few minutes before 3, and this discussion with finance could last a long time and get interrupted. Do we want to start it or table it? We will. We'll have to, I'm sure we're not going to get very far through it.
So then we'll be double, I support we table it.
Right, exactly. All right, can I get a motion to table old business and new business till next meeting?
Yeah.
Second?
Second.
All those in favor?
Aye.
Opposed? All right. So we will move on then to board member issues or announcements. Does anyone have anything? Shelley?
We were told to bring our devices if we didn't know anything about Boardable, and I don't know who's supposed to help us with this. I didn't know that. I don't know who they are.
Yeah, I didn't know
Thank
that
you.
either. Yeah.
Carol, call him down. She's got
Okay.
you.
Perfect, thank you. Any other questions, comments? All right, any comments from the public? Tabling, yeah, that's for the bylaws, I believe. Oh no, yes, it's one of that we're tabling. Everything else we'll be tabling. Could I have a motion to adjourn? Second? Those in favor? Opposed? All right, meeting closed.